Does 5% liquid minoxidil work better than the foam? Most research I've read says both show similar results. I've also read the foam does not work as well because the different inactive ingredients don't allow it to penetrate as well. Is this true? If so, could it also be because the foam tends to be applied in the hairs rather than directly on the scalp? Thank you for your help and information.
Thank you for your question. You submitted your question without a photo, and you're asking in your question about the relative benefit of a 5% solution of minoxidil in comparison to a 5% foam application. And you state that you've done research which shows comparable results, and yet you still have questions about the relative effectiveness based on the actual deliverability of the product to the scalp and the ingredients that are affecting this bioavailability. Well, this is the kind of question that certainly comes up in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system of helping people with hair loss, both men and women, with mostly androgenetic or genetic pattern hair loss, using a stem cell technology, using a combination of platelet-rich plasma and acellular matrix, which was derived from another procedure called hair transplant, and to help expedite the healing of hair transplant patients. Well, we've developed this treatment, and we treat patients from all over the world, and the management of hair loss is really the core of what we're doing over the past 8 years since the progression of development of this treatment. So the questions about minoxidil and finasteride, but for men, is something that we deal with every day. So when you get into the details of a question like this, and when you look at the often dermatology-based studies that are comparing one versus another, a liquid versus a foam, or combinations where different other ingredients such as retinols have been added, and maybe other topical progesterones and other things have been added, it becomes a challenge to really get a clear, absolute answer. Generally speaking, these studies are relatively small in number. You're looking at, and when you talk about small numbers, statistical differences are hard to achieve. But there's also a certain reality, and that is the limit of what topical minoxidil can do. Topical minoxidil was, as you probably already know, was derived from the use of minoxidil as an antihypertensive medication. And like our hair regeneration treatment, there was a pleasant side effect of hair growth. To this day, the mechanism in which minoxidil works remains unclear. Essentially, there is a pharmacologically induced improvement of scalp coverage, typically in the crown area and beyond, when topical minoxidil is applied regularly. Generally speaking, the reason the foam was developed had to do with some scalp irritation due to the active ingredient that was necessary to break down the top layer of skin called propylene glycol. And this chemical became, in the liquid form, became irritating for some people. And this is something that we're all familiar with. Anyone who manages hair loss. Patients will sometimes complain of redness, they'll get folliculitis, they'll get other problems. And so the use of a foam came in very, very handy. Now, from my perspective, I think that there is likely to be pretty much a comparable result. And in my practice, I generally tell my patients who are committed to using the foam to just continue using the foam. Now, it's very important to also have a global understanding of your hair loss progression. Over the course of the 8 years or so that we've done hair regeneration, and briefly, this is a system developed when we were using acellular matrix and platelet-rich plasma derived from your own blood to help the outcome of hair transplants. We wanted the hair grafts to heal better, we wanted the donor area to heal better, and we wanted to just expedite the healing process. And of course, we got to find out that thinning hair became thicker. Well, it took a lot more work to really figure out how this treatment can be dosed and adjusted to make it consistent for men and women of all ages and all ranges of degrees of hair loss. So over this time, I developed a classification system. This classification system factors in current age of onset of hair loss, degree of progression, rate of progression, other medical problems, and we've come up with a system that we also apply when we manage our patients. And so one thing to be really mindful of is that hair loss is progressive. If you are fortunate enough to have very slow progression, then certainly you have a certain amount of breathing room in terms of scalp coverage using minoxidil as a standalone treatment. Generally speaking, when patients come to us for evaluation, and they often have already tried a lot of treatments, including minoxidil, they're often aware for the first time the relative extent of their hair loss, which comes often as a shock. And it's important to be as proactive as possible when it comes to managing hair loss. I always explain to everyone that there is no cure for hair loss, but there is a strategy for optimal management. And whether you're using a pharmaceutical, and if you're a male using finasteride and minoxidil, or whether you're using a stem cell-based technology like hair regeneration, or whether you're doing surgical transplantation, you are trying to achieve maximal coverage. But I would assert that it is also critical to maximize the longevity of your existing hairs with whatever tools is available. And this is where it becomes a clinical discussion with the patient about what they're comfortable with and how motivated they are. So understand that, yes, you can certainly probably take some comfort in knowing that the minoxidil foam is an effective treatment in the management of your hair loss. But I would also say learn about the use of DHT-blocker like finasteride, as well as the technology of hair regeneration, which we've become very well known for. Patients come to us from all over the world, and we've developed a system so that we can maximize the longevity and coverage of their progression of their hair loss. A lot of times people do things to treat their hair loss and miss a very important window of opportunity when they could have done something. And now that these treatments are well established, it is often the hindsight, when a patient, in hindsight, that patients realize that they could have done more if they had done an intervention sooner. So I tell a lot of our patients, and of course when they come to us and we take all our pictures, and we take a lot of pictures, when we see the top of the scalp, very often they have a lot more hair loss than they thought they had. Because when it comes to both male and female pattern hair loss, it affects the whole scalp. The progression is variable in the expression. So you may look and see you have a little bit of a receding temple, and you may think you have a small bald spot. But if your hair is wet, you may realize that the scalp is has a lot less hair than it did 5 to 10 years earlier. And then therein lies a window that you could explore these other treatments. So learn more about the other options, and I think you can probably take some comfort in doing the minoxidil foam. If you still feel that the liquid is the way to go, well then certainly go ahead and do the liquid. But understand the thinking behind that was to try to avoid skin irritation, and hopefully you'll be able to hold on to your hair longer than your genetic plan. So I hope that was helpful. I wish you the best of luck. Thank you for your question.